Hello, my name is Chelsea, and I'm going to be talking about a dubious treatment for autism, hippotherapy. No, it is not treatment with hippos, but with horses. Also known as equine-assisted therapy or therapeutic horseback riding, it has origins back to ancient Greece, when the physician Hippocrates declared horseback riding a great natural exercise. Fast forward to the 1960s, physical therapists in Western Europe began integrating horseback riding into their patients' regimens. Horseback riding provided an outlet for building core strength, working on balance, and honing fine motor skills, along with large motor skills. In the late 1980s, however, a group of therapists from North America traveled to Germany in order to perfect their horsemanship, and brought back with them the inception of the American Hippotherapy Association, which was founded in 1992. The AHA created rigorous certification requirements, including a training period of 3 years. During this time in the early 1990s and into the early 2000s, hippotherapy was gaining popularity. And on the news, once in a while, we would see fluff pieces showing heartwarming images of children with disabilities on horseback, and they were inspiring, tear-jerking, but they provided little explanation as to what this therapy actually was. In these segments and in the resources examined, there's no real explanation of what the standard hippotherapy session looks like. Some are solely a child atop a horse walking around an arena. Others incorporate physical therapy exercises, some OT practices, and even channel ABA skill acquisition type exercises. None of the literature or studies really explain this, and in all the studies that I examined, they really only specify the length of the session on horseback. They didn't specify what activities were being done. So I ask, why do these activities have to be on horseback? And the AHA answers my question. Proponents of hippotherapy claim that because of the three-dimensional dynamic movement of the horse, each step a horse takes translates into a neuromotor input in the rider. According to the AHA, evoking these neuromotor inputs is a powerful tool for the facilitation of key neuromotor systems that support function and offer the patient the opportunity for complex motor learning. This sounds scientific, but upon closer inspection, there is no scientific basis for these claims. While there are a great deal of studies, they are flawed. They rely majorly on parental survey, which can be subjective in nature. They lack replicability, like I was talking about before. The sessions differ from session to session, and content is not standardized. Neither is length. And there's a risk of developing novel, challenging behaviors in some participants. In two of the studies that I studied, 2 participants developed new aggressive behaviors, and one of these participants became aggressive toward the horse, which is an entire ethical conversation that is beyond the scope of this project. So therefore, hippotherapy is not recommended for children with autism. There's just an unnecessary risk. I personally rode horses competitively and non-competitively for over 10 years. I've suffered falls, broken bones, and even a concussion. Horses are prey animals. They have 360-degree vision, however, it's not the clearest. Therefore, they can scare easily, and they react by running away. These falls off horses can be dangerous and even deadly. Horses are not accessible to most. The sessions themselves cost between $115 to $300 per session, from what I could find. Horses need a lot of space. They cannot be kept in cities, and most therapy centers are 25 or more miles away from cities, if lucky. One of the main studies that is a piece of evidence against hippotherapy was Jenkins and Reed's piece in 2013 entitled An Experimental Analysis of the Effects of Therapeutic Horseback Riding on the Behavior of Children with Autism. They found confounding variables in most of the studies that were on hippotherapy. Reinforcement was provided for social behavior during baseline, and therefore increases in socialization during or after intervention could be due to that reinforcement found in baseline. Another confounding variable that I found was they could perceive increases in clients because they're using ABA type or OT or physical therapy interventions. They're just on top of the horse. It may not be the setting of being atop of horse that is creating this behavior change. Okay, the authors made a note of the reliance of indirect measures in most of these studies. And when they implemented direct observation measures in their studies, they received results that contradicted the previous studies. So what is an alternative to hippotherapy? Do it on the ground. Whether it's ABA for social skills, physical therapy for motor or muscular related issues, reduce the risk and perform these interventions on dry land. If children do find horseback riding reinforcing, perhaps they can earn it in a token economy. Or we can use the Premack principle, first reading, then horses. Or if they get all their tokens, they can go to the barn on Saturday. There are, I will mention, some interesting advances out of Rice University where a team of mechanical engineering students built a robotic horse, Stewie, to be used as a therapy aid. This one solves the problem of not having access to horses. It's much less dangerous than a sentient animal. And the students put all of the instructions, blueprints, and materials needed to make Stewie, the robotic horse, on an open source website, and allegedly one could build their own Stewie. But of course, much more research needs to be done, and as of now, hippotherapy cannot be recommended as an intervention for kids with autism because it is not evidence-based. Thank you.